Okay, so we're back with another prescription rating question. And here we're being asked about a patient that is a 52-year-old male whose chief complaint is that the gums around his tooth hurts. And the history of the chief complaint and the medical history will be really important because here we're looking for indications for prescribing whatever antibiotic or analgesic you'll be writing a prescription for. So here in the history of the chief complaint, we see that there is pain with the associated tooth has been worsening. Patient reports developing a fever around the same time he noticed pain around the associated tooth. So this fever is going to be really important because the fever tells us that there is a systemic manifestation of the odontogenic infection that we're experiencing. So when there's systemic involvement, systemic symptoms like fever, like lymphadenopathy, like cellulitis, this is when we would prescribe antibiotics to help tame the infection. So here the patient has fever. Dentally, he doesn't receive regular dental care, and medically, he only has hypertension, and so that's non-contributory to whatever we're prescribing. On the clinical exam, we see that the patient has gross caries on 1/6 with negative pulpal tests. There is a paryllis visible on the buccal gingiva of 1/6, so the paryllis indicates that there is some sort of infection going on, or there's some sort of inflammatory reaction going on. So, for the prescription, we are going to look at what is commonly prescribed. So the first line antibiotic you'll use is amoxicillin. So amoxicillin is the standard antibiotic that you'll prescribe, unless it states otherwise. So unless there is an allergy for amoxicillin or unless the patient has been prescribed amoxicillin in the past and it hasn't worked. As well, the second line option that we would use is amoxicillin and clavanulate. So clavulanic acid or clavanulate is basically in addition to amoxicillin. So if amoxicillin doesn't work the first time, you'd prescribe amoxicillin and clavulanic acid. But here we're prescribing for the first time, so we'll use our typical amoxicillin. So the dosage for this is 500 milligrams 3 times per day. And so that's what we're prescribed. So the drug of choice will be amoxicillin. It'll be 500 milligrams, and we are going to dispense 21 tablets. So the patient is taking amoxicillin 3 times per day, and so we're going to want a 1-week course of amoxicillin to clear the infection, to clear the symptoms associated with the odontogenic infection, which is the fever. So 7 times 3 is 21, so we'll dispense 21 tablets for a 1-week round of amoxicillin. And we're going to tell the patient to take 1 tablet TID, so 3 times per day until finished. And of course, this being a 1-week course of antibiotics, we're going to have no repeats, and we're going to reevaluate the patient after this week of antibiotics to see how the infection is coping. So this is what the final prescription should look like.